Well, it's not something too many people talk about, but too many people are dying from. We're talking today about colorectal cancer with Dr. Nadav Dujovny from Spectrum Health Medical Group, and also with our friend Kim Carson, who's a survivor.
I'm a survivor.
So, Kim, tell us about your experience and why this man, you really literally saved
He did
your
save
life.
my life. You know, I had an abscess kind of near my butt cheek, and I had to go in, and he lanced it. And he said it should, I had no symptoms, no family history. He said it should heal up normally, they mostly do, and in about 3 to 4 weeks, go for a follow-up. I went for the follow-up, and it did not heal correctly. And so he said, I've got to go in now, we've got to let it drain out, and I have to put you out for that. I'm like, no. And he said, no, well, I have to, that's the only way we can do this. I'm like, no. And he said, but you're going to have to do that, and why don't you just let me do the colonoscopy because you're close to the screening age. I wasn't even of the screening age yet.
Okay.
And he said, because you're going to be out anyway. And when he said that, it was like, okay, do it. And I do credit him for saving my life. This would have taken my life, or it would have been at a late stage, because I would have never had a colonoscopy, because you're always thinking, when's the right time?
Right.
When's the right time to schedule a colonoscopy? There is
no
no right time.
Yeah, I know. I'm sitting here very guilty because I turned 50 very publicly in November. Still have not had
But you're
mine
going to do
yet.
it, right?
But I am going to do it. You both have definitely
Good.
motivated me. So Kim did not have any symptoms. She didn't have any of the risk factors, but let's just identify some of those for our viewers.
Sure, and you know, she did have a little bit of symptoms in terms of having some bleeding and stuff with the abscess that she had down there, and so that was the reason why we went ahead and, you know, why I had recommended it for her. Plus, she was very close to the magical age of 50, and so I said we can just kind of do these both at once and take care of the abscess definitively, and then go ahead and screen for the colon cancer.
And
as
at the
well.
time, she was overweight.
Yeah, I was obese.
And so
Yeah.
that is one of many risk factors.
Those were the two I had, obesity and activity. That
Okay.
was it.
But otherwise, there are a lot of other risk factors.
There are a lot of risk factors: smoking, alcohol intake, diabetes. If you a lot of red meats or processed foods as well. Certainly, if there's a family history, that increases your risk. However, about 85% of all colon cancers are actually sporadic, so those people that don't have family history. So a lot of people think that if they have a family history, that's the only reason they should get checked, but most people actually do not.
Okay, and so we talk about some of those symptoms. You sort of had a minor symptom, but Dr. Dujovny, what are some of the other ones?
Well, certainly any bleeding when you wipe or in the stool. If you feel like it just sort of change in bowel habits, so whether worsening constipation or feeling that the stools are more narrow, you can have fatigue. People can present with anemia. I've had people present with all different types of weight, but weight loss and a lot of those symptoms.
Okay, so let's talk about that colonoscopy. Kim, you were already prepped and ready to go. Tell us about what the actual test is, the colonoscopy.
So the colonoscopy is typically patients come in, they get an IV, so that way we can give them medication to sedate them, and so that way they can just kind of nap and sleep through the procedure itself. Most patients do not remember anything from it. They wake up and they're like, "What, am I done already?" So it's actually very comfortable for patients. So, but the test itself is, so after they get sedated, then you put a camera in their bottom and then look throughout the entire colon. Anything that's unusual in there, so biopsies or inflammation or anything else, or polyps, you can biopsy. The nice thing about a colonoscopy is that polyps are precursor lesions for colon cancer, and so if you remove a polyp, then that thing doesn't grow up and become a cancer. So colon cancer is actually the most preventable cancer out there.
And it's slow growing too, which
Yes.
is a surprise because you hear about people who are diagnosed and then right away it seems like it's a death sentence, but only for those individuals oftentimes that put off the early screening, right?
Correct. And so for a 1 centimeter polyp to grow up to become a cancer, typically it takes anywhere from between 6 to 9 years.
Wow.
So it takes a while, and so that's why you can remove these precancerous lesions, and then you tell someone that, okay, I'll see you in 5 years, or I'll see you in 3 years. However, if someone has a normal colonoscopy without any risk factors, then you would go ahead and say, I'll see you back in 10 years.
And if people are interested in getting in touch with you, how would they do that?
They can call my office. My telephone number is up on the screen there, and you can set up colonoscopy through that.
And this is a procedure you do right in your office?
It is actually right underneath our office. There's an endoscopy center on the first floor there.
And Kim, your advice to anybody sitting at home?
Well, don't let the fear stop you. Don't let the fear, whatever your reason is, if it's fear, if it's something else, you know, this is something that can be prevented. Like if it's caught early enough, it can be prevented. And the best part is that the more normal ones you have in a row, the less you have to go. So just get it done.
Fantastic.
Get it done.
Kim, thank you so much. Dr. Dujovny, thank you so much. And I'll get your phone number written down so I'll get my appointment scheduled right away. If I need a driver, Kim, you're available.
Drive you. I'll drive you. I'll drive
I
you.
appreciate that.
Well,
Stay right there.
we-
More of 8 West when we come back.
Are you West?